Well, I'm here with Megan Galloway, a certified nurse midwife over at Barton Health. Megan, thanks for being here today.
Of course, my pleasure.
Yeah, and so I just want to know, for me and the audience, what is a midwife?
Great question. So I get asked this almost every day. So it's important to note that myself and the other nurse midwife over at Barton are certified nurse midwives. And so there's a little bit of a difference between that and, say, a lay midwife that maybe does home births. So a certified nurse midwife is a master's trained nurse. We were all nurses first, and then we got our master's degree in nursing. And so we are basically the same thing as a nurse practitioner. We just have a cooler title because we get to deliver babies as well. We can do pregnancy care, we do deliveries over at Barton, and then we also, I think a lot of people don't know that we do a lot of women's health care as well. And so we might see you for your annual exam and your pap smear, or for routine STI screening, sexually transmitted infections. We can do all the birth controls, and we also work with women not just of childbearing age, but we also work with women who are, say, perimenopausal or menopausal. We do hormone replacement therapy and things like that. So we work with women of all ages, and I think the community maybe doesn't know that, so glad you asked.
Yeah, is there anything that's really specifically different for a midwifery than just a normal nurse in the OBGYN?
Yeah, so that is a good clue because you just said midwifery, but it's actually midwifery. So I like to think of it as midwiffle ball bat, which is fun. So midwifery, I think historically I've said that we are all nurses first, and so we love educating people, we love spending time with people, we love being empowering to women and teaching them about their bodies. However, I would say that joining the team of the certified or the board certified OBGYNs over at Barton, they all practice really similarly to midwives. I have been so impressed with how much they care for patients and how well they take care of them and listen to them. So at Barton, I don't know that there's a huge difference other than scope of practice, which nurse midwives are not doctors, and so we're not surgeons, and we also, in the pregnancy realm, take care of low to moderate risk patients rather than the really high risk patients, which the great thing about Barton is a lot of times we can co-manage with our physician partners. So if a patient really wants a midwife, but they may become high risk in their pregnancy, then they can see both the doctors and the midwives and get the best of both worlds.
Well, that's fantastic. And if some of our audience want to learn more about midwifery
Yeah.
or go visit, where can they check you out, more information?
They can go to our website, bartonhealth.org/OBGYN. Just of note, we have 2 different offices. There's one here at the lake, and there's also one in Minden. And so you can go to either location. You can find our phone number on there and also information about all of us providers.
Well, thank you so much for being here.
Of course.
And again, this is Megan Galloway, a certified nurse midwife over at Barton Health.